Greetings everyone. I'm Dr. Ragavi Vijayaragavan, lecturer from the School of Dentistry at IMU University. Today, I'm delighted to present Market Blocket, an interactive simulation for inferior alveolar nerve block administration. The project was developed through a multidisciplinary collaboration between the School of Dentistry and the IMU e-learning team. The inferior alveolar nerve block is one of the most commonly used injections in dentistry, and it is a skill every dental student must learn. However, it is also one of the most challenging because it is essentially a blind procedure. The nerve, blood vessel, and the important bony landmarks are hidden beneath the soft tissues and cannot be seen directly. Students therefore rely on anatomical landmarks to guide needle placement, and accurate contact with the bone is an important indicator for correct positioning. If these landmarks are identified incorrectly, the injection may fail, resulting in repeated injection, inadequate anesthesia, and potential complication. So how do we currently prepare students to perform this challenging procedure? At IMU University, students learn this procedure through lectures, demonstrations, mannequin practice, practice on classmates, and eventually supervised administration on patients. While this pathway is valuable, each stage has its own limitation. To address this gap, we developed Market Blocket, an interactive simulation that provides safe, accessible, and repeated practice before patient-based training. Having identified this gap, we established four key objectives to guide the development of the simulation. The objective of this project is to enhance anatomical landmark identification, provide standardized deliberate practice, strengthen procedural competency, and improve clinical self-efficacy. What makes the simulation different is that learners first explore the anatomy rather than simply memorizing it. They can rotate a three-dimensional model and receive immediate explanation as they learn. Once they understand the anatomy, they move into the perform phase where they complete the procedure step by step within a structured simulation. Beyond the current version, the platform can be integrated into the curriculum, expanded to additional nerve block technique and enhanced clinical scenarios and AI-supported feedback. Interestingly, learners' feedback strongly supported these future development. While innovation is important, it must also be practical and useful in every. One advantage of the simulation is that students can access it anytime without waiting for scheduled laboratory sessions. The platform also provides immediate feedback, helping learners understand not only what is right, but why. Although developed for undergraduate students, it can also support postgraduate learners and clinicians wishing to refresh their knowledge. Because it is a web-based, it can be used across tablets, computer, and mobile devices. These features make the simulation accessible, flexible, and learner-centered. To evaluate the simulation, 60 participants representing three different experience levels completed pre- and post-simulation questionnaires. This included novice, beginner, and advanced learners. Confidence improved across all learner groups with the greatest improvement observed among novice learners. Participants also reported better understanding of anatomical landmarks and procedural steps together with high level of confidence and overall satisfaction. Importantly, clinical supervisors observed that the students appeared better prepared for supervised patient practice. Overall, the findings demonstrated positive educational outcomes in knowledge, confidence, and clinical readiness. Because the platform is browser-based, students can access it from multiple devices whenever learning is needed. The framework can also be expanded to support additional local anesthetic and nerve block techniques. Repeated practice is possible without additional laboratory resources, helping students reinforce their skill independently. Future plans include collaboration with other skill laboratories and the integration of virtual reality-based learning experiences. Encouraging feedback from faculty and learners supports the continued development of this innovation. These features position the platform as a scalable and sustainable educational resource. For more detailed exploration, the module can be accessed through the QR code and Learning Pathway program. For completeness, the key references supporting this project are provided here. Thank you for your attention. Market Blocket is built on a simple but important principle: mark the right landmark, block the right nerve. By helping learners visualize hidden anatomy and practice procedure in a safe environment, it bridges the gap between preclinical learning and the clinical practice while supporting confidence and competent patient care. For further information, please feel free to contact me through the email address provided. Thank you.